Tēnā koutou katoa, called Brent Muskimana. I am the Injury Prevention Leader of the Live Stronger for Longer program at ACC. So kia ora and welcome to this webinar today. As I said, I know it's a very busy time of the year, so it's great to see so many people here and people still coming in. So great to have you all here. Welcome. Before we start, I'd like to run through our ACC karakia. Just go to the next slide, Cam, and I'll come back to that one. Please join in with me if you're able. Whaia te tika, whaia te pono, whaia te araha, mo te rangatangata, kia puta, ki te whaio, ki te o marama, homi e, hui e, taeke e. Thank you. Just back to the other slide. As I said, it's great to see so many people here. We will be recording this, as it says, so you'll be able to view it later following the event or share it with people that are unable to make today's event. So the way that we'll run things today, we'll have Paul Kennedy, our manager of targeted investments at Injury Prevention ACC. Paul will take us, or PK as we know him, will take us through the Live Strong for Longer evidence-based program as a quick overview. And he'll also talk to why we commissioned ImpactLab to help us run this report. We'll then pass the baton over to Daniel Bosnan, Principal Impact Analyst of ImpactLab. So Daniel will talk us through the background to how ImpactLab have developed their model and also talk us through what he has found, what they have found as part of our program. So we will, I'd rather if you could just post your questions, if you could, on the chat, and we'll address those afterwards. We think we'll have at least a quarter of an hour, possibly even 20 minutes to have a Q&A afterwards. So that'll create some interesting discussion. We'll also, if you want to see the report, please email us afterwards. We'll give you the address for that, and we'll send the report to you, or we'll do it in a follow-up email. So again, welcome everyone, and I'll hand over to you, PK.
Got a burnt, tēnā koutou katoa, everyone. Ko Taratahi te monga, ko wahine te awa, no wairapa ahau, ko Kennedy tauka whanau, ko PK tauka ingoa. I'm Paul Kennedy. I lead the targeted investment portfolio here at ACC for injury prevention, and Live Stronger for Longer Aging Well is one of the portfolios that Brent and his team manage, and I'm part of. It's a pleasure to be here. Excited to go through these results with you, and just thought I'd just revisit, I guess, what the problem was and what led us to where we are today, very briefly. So I just want to talk about the falls are the most common and costly injury in Aotearoa for people over 65 years of age. I appreciate many of you may know these facts, but it's worthwhile calling some of them out just to remind those that may not be as familiar with them. Between 30 and 60% of people aged 65 or older will have a fall every year, and 10 to 20% of those are quite serious, subject to hip fracture, lead to hospitalisation, and can lead to aged residential care following that. Most of the older adult fractures are caused not by the fall itself, but by the undiagnosed bone disease known as osteoporosis, which affects 1 in 3 women and 1 in 5 men. The World Health Organization actually states that for women aged 45 plus, osteoporosis accounts for more days in hospital than diabetes and breast cancer combined. So it's a significant issue. For ACC, in 2023 alone, we accepted 173,000 claims for falls and fractures relating to people over the age of 65. These injuries cost ACC around $345 million in 2023, and that had grown 59% since 2021. So it's rapidly increasing with our aging population. 7 to 11% of all hospital bed days in New Zealand are consumed by older adult falls and fractures. That's a massive percentage, and if we estimate if we do nothing about this, that obviously the cost and that percentage of bed days will double by 2035. So it's a big issue. This is a problem that doesn't just affect ACC, it is driving significant demand into the health service and affecting communities, whānau, and obviously older people. The evidence tells us that 30 to 40% of those injuries are preventable quite quickly. And that's what Live Stronger for Longer is all about. So what we're doing, well, we're trying to prevent falls in older people to allow them to remain confident, healthy, and independent in their homes and community. We created the program in 2016 originally in a partnership with ACC, Ministry of Health, and the Health Quality and Safety Commission. But I do want to reiterate that the program and the success we've had, primarily since 2020, would not have been possible without the support of Osteoporosis New Zealand and a large number of people who have championed the program within hospitals, PHOs, and communities. There is a large group of people who are playing a significant role in the value of this program. The program takes a systems approach to sustainably and materially reducing the rate of falls and fractures in our older population, and it consists of two primary parts in terms of interventions. One's prevent the fall. If we don't have the fall, we don't have to worry too much about the fracture, regardless of how fragile you are, but that's an impossible task probably in reality. We do the falls prevention through two main streams. We've got over 1,000 community strength and balance classes distributed nationally, and we have a digital app known as Nimble that's available to anyone in the country, free of charge. If people are unfortunate enough to have a low impact injury and people over 50 come into the hospital with a fracture, every one of those people over 50 is increasingly being assessed for the underlying root cause to determine whether that's a fracture that a healthy person would have sustained. That's where our fracture liaison service comes into effect. We're following a world's leading best practice approach and following the evidence that we've seen in international models. It's a secondary prevention intervention that basically aims to recognise the first one and prevent future fractures from happening downstream. Finally, just why are we here with ImpactLab? Welcome Daniel and the team. This has been great work and it's been a pleasure working with you. ImpactLab have built a strong reputation for accurately calculating the social value of benefits New Zealand accrues from public sector investments being made to improve the lives of New Zealanders. Their reports and processes link social value measurement with public sector investment decision making. We've seen that and we recognise that, so we wanted to get on board, and that we recognised that the social value of Live Stronger for Longer was far greater than just the claims cost being avoided. It was also clear to ACC that no single agency or organisation can optimise the value of public sector investment by acting alone. Social investment and optimising the investment from those sorts of things is a collaborative and contributory requirement. And our hope is that this report from ImpactLab and the mahi they've done will encourage and support all health system and ageing well stakeholders to collaborate and align our respective efforts to optimise the personal, social and economic benefits of social investment and this particular program in New Zealand. So with that, Daniel, I'll hand over to you to share your findings.
Awesome. Thanks, PK. Appreciate it. And kia ora, everyone. As mentioned, my name's Daniel. I'm a principal impact analyst here at ImpactLab. I've had the pleasure of being with the organisation for about 3 years now, working across various different sectors, various different organisations. I must admit, before this piece of work, I'm not quite in the age bracket where I was aware of Living Stronger for Longer, but it's been a real privilege working with Brent, Cam, and the rest of the ACC team on this piece of work. So yeah, really excited to present the results today and the metrics, but also I just want to give a big shout out to the ACC team for all their input here as well. So yeah, thank you for having me today. I'm going to be running through essentially a summarized results workshop for the ACC Live Stronger for Longer program. This is essentially a consolidation of a lot of the outputs and the work that we've done with ACC over the past 6 months to kind of present it within kind of a 30-minute format. As mentioned, if you have any questions, please post them in the chat and we'll do our best to answer them at the end of this call. Also, there'll be an email at the end to get in contact with ImpactLab or ACC should you have any questions or kind of follow-up things you want to become aware of. So I want to quickly run through how ImpactLab defines social value and essentially maybe why we exist as an organisation. There's a really significant question within the public sector at the moment about how you can actually know the good that you do. Impact is quite uncertain and it's particularly difficult to quantify. And at ImpactLab, we essentially exist to provide an estimate of that impact through a concept known as social value. Now, social value is the estimated social impact in dollar terms that a program achieves for participants over their lifetime. So throughout our lives, different events occur that impact our overall wellbeing journey. ImpactLab measures the impact on individuals' wellbeing across multiple domains when they're supported by a program to make a positive change in their life. We measure this impact in terms of both positive benefits, such as increased income, increased physical health, for example, but also as avoided costs to government as well. To calculate social value, we combine these impact values with evidence from the global literature about how effective a program such as Live Stronger for Longer can be. We also want to understand the size of the opportunity for the people an organization serves to achieve more positive outcomes. And we also want to understand the scale at which this support is provided. We look at participants' journeys over time. We want to consider what their past experiences have been, kind of what their present life well-being is, and also we want to understand what their potential future is. You can see on this graph here on the right-hand side, there's this point at which the program begins interacting with an individual. And this visual here is just trying to communicate this idea that we're really interested upon the interaction of a program or a service with an individual. What is the positive upward shift we can observe in their well-being? And then we can relate this back to the potential long-term negative trajectory that might have been going on without interaction with, in this case, living stronger for longer. The difference between those two trajectories or pathways is how we perceive social value as a concept. So to measure social value, in the case of living strong for longer, we perform an equation that has essentially 4 key drivers or 4 key components. The first is opportunity. So this is really looking at what is the opportunity to make a difference. The opportunity piece is really thinking about what chance did ACC have to make a difference. So for example here, and as an example, if you were trying to reduce maternal smoking across some program, and half of the mothers were already non-smokers, then you aren't going to be able to make a difference for 50% of those people. In the case of ACC, obviously they've identified a population that have significant risk for falls, and so they've targeted that, and the opportunity to make a difference there, as PK touched on, is quite significant in Aotearoa. The second is outcomes. So this is essentially what is the monetary value we can attribute to this positive change. This considers what the change is that we're seeing. So the outcome in this case might be to reduce injurious falls. Within that outcome, we might attach several different impact values to it. So for example, when participants interact with the fracture liaison service or community strength and balance or nimble, we might consider things such as the impacts to a participant's physical health through their quality of life, also looking at reductions in healthcare costs, for example. So we can take kind of both, kind of quantitative measures, but also internally we've developed things to account for improvements in physical health or mental health associated with community strength and balance, fracture liaison service, and also nimble as well. To kind of get this information and conduct these measurements, we draw on the IDI. So the IDI is a linked up data set, essentially of all government data stored on people within Aotearoa. And then we combine this with internal measures and metrics as well in our internal algorithm to generate those outcome values. The third driver is effectiveness. So essentially, what is the literature telling us about effective service delivery? So this is the component of our process where we're really focused on understanding how effective is the way that ACC works. So this entails us looking at national and global research and evidence and comparing it to what ACC is doing and best practice. And essentially that forms a key driver of the model. And the last is population, which is essentially asking the question of how many people are you serving during the period and scope and at what scale. These things combine together within our model to generate a summative dollar figure of the social value. And then when we divide this by the cost, we can determine the social return on investment. We can also look at dividing across different participant groups within scope to get the social value per person, social value per participant based on the programs as well. So the next thing I just wanted to reflect on quickly before diving into some of the metrics was just highlighting for you all the scope for this GoodMeasure. So at ImpactLab, when we go through a GoodMeasure process, we want to kind of determine a period and scope, essentially 2 lines in the sand where we have a measurement period. The period and scope for this measurement was from the 1st of July 2022 to the 31st of December 2023. And I guess what this means is all of the participant data we collated fits within that time frame, and then also the costs for the programs within those time frame were the figures that we used. For this Living Stronger for Longer GoodMeasure, we looked at 3 key kind of program streams. We looked at Nimble, which is a balance exercise app, which enables users to regularly do balance exercises via kind of simple body movements, typically at home. We also looked at the Community Strength and Balance program, which are classes focused on improving lower body and core strength and balance, which ultimately is focused on leading to improvements in movement ability and confidence. And then the last is the Fracture Liaison Service. And this is a service that identifies, investigates, and where appropriate, initiates treatment to prevent further falls and injury related to those kinds of fractures. Just some notes for context. So in regards to this period and scope, we looked at that entire window for Community Strength and Balance and Fracture Liaison Service. And for Nimble only really started to gain momentum and traction in April of 2023. And so the measurement for this program has essentially started from there. There's 2 really crucial components to a social return on investment. Obviously, the social value is generated, but we also need to relate this back to the costs. And so I just want to really quickly touch on for you all the investment made within Live Stronger for Longer. So the total investment within this period in scope was about $10.7 million, split across about 1.1 million for Nimble, 3.4 for Community Strength and Balance, and about 6.1 for the Fracture Liaison Service. One of the really interesting things that we like to provide also at ImpactLab is this idea of cost per person. So helping ACC understand what it actually looks like to serve an individual in each program stream. As you can see on the screen, for Nimble, the cost per participant was about $59. The cost per person for Community Strength and Balance was $114, and the cost per person within FLS was $321. And averaged out across the entirety of Live Stronger for Longer, the cost to serve each individual is sitting at about $157. Throughout our process, we worked really closely with the ACC team to make sure that these data points were comprehensive and ensured a representative cost of operation and a cost of actually achieving the outcomes that we're going to discuss soon. So I guess the interesting part, probably the part that you're all here for, is to discuss the GoodMeasure metrics for the Live Stronger for Longer program. So first up, we have the total social value generated. So this first figure you can see is essentially providing a summary of the value generated across these 3 program streams within the period and scope. Just highlighting again that this is the estimated lifetime social value that this program has generated for participants during this measurement period. And I guess for context, this is quite a significant number, 55 million of total social value, for New Zealand. And so, yeah, quite a significant contribution, particularly obviously in this health domain. And I guess when you kind of start relating this back to the cost made over this period and scope of 10.7 million, we start to dive into some additional figures as well. So the first is the social value per person. So essentially what you can see here is that on average across the 3 programs, the program has created $1,130 of social value per person. However, given that we're looking across kind of the 3 sub-programs, we can also split this into the different groups. So when we segment this, we have $600 for each Nimble app user. We have about $1,500 for the Community Strength and Balance participants, and about $830 for the Fracture Liaison Service participants. This gives us a social return on investment overall of $5.20. So essentially for every dollar invested into Live Stronger for Longer, we're able to estimate a return of about $5.20 of social value. I guess this is a good time to add some context. So I think, the main reasons we're observing quite a high social return on investment is the scale at which this program is operating, but also the fact that it's operating at scale and able to achieve quite significant social value per person as well. And, those things combine together to generate this quite positive ratio. I guess some further context as well is that $5.20 is definitely on the higher end of kind of the spectrum of what we observe here at ImpactLab. So yeah, overall, a fantastic result for the Live Stronger for Longer team. And just kind of, these figures are providing kind of encompassing the benefit that this program is providing to Aotearoa Inc. But yeah, if you have any questions for me or for the rest of the ACC team, put them in the chat and I'll do my best to answer them at the end of the call. So what do those numbers actually mean? As you can imagine, measuring social value is quite a complex, difficult process. There's also some limitations. And so we do want to acknowledge those. We can't measure kind of everything in this case that ACC is able to measure. But we do have essentially two tranches of outcomes that I want to communicate now. The first is GoodMeasure outcomes. So these are outcomes within our kind of internal process that directly contribute to that $55 million of social value. So these are things that we can measure. They're things that have impact value associated with them. The first is reduce injurious falls. So this outcome was applicable to all three programs. The next was improve mental health, which we observed was applicable particularly to nimble and strength and balance. We also have an improvement of physical health, which was particularly applicable to the fracture liaison service. We then have the remaining two outcomes, which was reduce hospitalization and a reduction in ED visits, which are applicable to all three program streams. And so those are kind of the measurable outcomes that we were able to draw into this GoodMeasure. On the right-hand side, there are additional outcomes. So these outcomes indirectly contribute to SROI. And by that, I mean, we weren't able to kind of have a specific dollar value associated with them, but they were key outputs that were identified through our research and throughout our process of interaction with the ACC team. But they also do provide, I guess, some support and encouragement for our involvement of GoodMeasure outcomes. So although they're not directly measured, they do play a part in our inclusion of the GoodMeasure outcomes on the left-hand side. And for context, how we define these outcomes, what they mean, will be in the kind of provider report that Brent mentioned. So if you would like further detail on the specifics of this, it will be included there. The next thing that I wanted to quickly chat about was the intervention logic. And so at ImpactLab, we go through this pretty comprehensive process over roughly 4 months to work with the customer, in this case, ACC, the Living Stronger for Longer team, to determine kind of what the inputs are to the program, what are the key activities, what are the key outputs that the Live Stronger for Longer team are observing, but also what does the research suggest are the key outputs. And then we connect this with the outcomes which drive through to the GoodMeasure outcomes. And this is essentially our logic for including specific outcomes. This is how we've essentially justified the impact. And this here is essentially a high-level overview of that process and how at ImpactLab we've connected the dots. So you can see on the left-hand side, we have some key inputs split for each of the key streams. So for example, for the fracture liaison service, some of the key inputs are this idea of the clinical standards for fracture liaison, the various funding and resources associated with it, the key diagnostic tools involved, data management systems. The key activities that we kind of highlighted from here was this idea of, identifying patients and being really consistent in the assessment of their fractures, bone health management, and then essentially getting them engaged with fall prevention programs. The key outputs here as an example would be, increased DXA scanning rates, treatment initiation, and kind of ensuring adherence with treatment. And then, also, educating patients and providing the necessary support. And what this does is it flows through for us and helps us to understand actually what are the key outcomes. And so in this case, we have, for example, higher rates of bone density, improved bone health, reduced fracture risk, for example, fall prevention, fracture risk reducing kind of lifestyle modification stuff as well. These flow through into our inclusion of the GoodMeasure outcomes on the right. We also have like a similar breakdown here, obviously, for community strength and balance, and also the nimble at home exercises. particularly looking at the activities. So again, really targeted exercises based on kind of research and evidence, using training structures. And also one of the key things that we did notice was that having elderly people also engaged in kind of a group environment not only provides this physical benefit, but also has kind of a flow-on effect in terms of increasing adherence, but also obviously community relationship and having relationships with others can also have a positive benefit as well. For the Nimble app, we have a similar kind of mechanism in terms of kind of exercise-based sessions. There's also educational content associated with this, and then progress tracking and feedback. And again, these things flow through into having key outputs such as exercise obviously being conducted, social connections, at-home exercise fidelity, widespread educational content distribution as well. And essentially across these inputs, activities, and outputs at ImpactLab and in combination with the ACC team, we've highlighted kind of some key outcomes that I've briefly touched on. But obviously the predominant ones here are strength and balance being improved, fall prevention, improving physical performance, improving balance and mobility. Obviously, all these things are flowing through to reduce injurious falls, to improve physical health, to reduce hospitalization of these participants, predominantly who are over 65 years, reducing ED visits, and also improving their mental health. And so appreciate that's kind of a lot of information, but it's just trying to provide a high-level map of our thoughts and our reflection on the Live Stronger for Longer program. The next thing I wanted to reflect on was essentially this idea of impact at scale. So Living Stronger for Longer supported about 50,000 participants to improve their strength and balance and reduce their risk of injurious falls within this period of scope. And in terms of adherence, this was about 71% of starting participants. And for those of you who aren't necessarily familiar with the impact methodology, we have essentially 2 participant counts throughout our process. We really want to understand how many participants start, but more importantly, we want to understand actually how many participants go on to engage with their respective program or stream to a significant amount that we are confident we can attribute value to them. So we don't want to just say, great, everybody who signs up gets value. We actually only account value to those who engage to a specific definition. So as mentioned, we had about 68,000 people starting with about 50,000 roughly engaging, so about 71% adherence across all the programs. For Nimble, we had 19,000 people starting, which was those who essentially download and sign up for the Nimble app. We had about 40% of those, so 7,000 who actually, partook and undertook essentially 4+ sessions. For Living Stronger for Longer Strength and Balance, we had 30,000 people starting, which was when kind of participants begin their first community strength and balance class. We then had quite a significant adherence here of about 88%, where 26,000 of them went on to consistently attend community classes, which was defined as essentially having 10 sessions per quarter or over the 3-month period. And the last there is the fracture liaison service. And so we had about 19,000 starting, which was having 19,000 kind of making a claim, getting entered into the Australian and New Zealand hip and fracture registry. And we had about 80% of those, so 15,000, who went on to have a multifactorial clinical assessment, including falls and fracture risk assessment within 12 weeks of their fragility fracture. And I guess for some context, we worked quite closely with the ACC team here to kind of define that engagement definition, working with them to understand at which point do you guys believe that your participants really start to receive benefit, and when can we be confident to attribute impact? For some context, in terms of the kind of the ImpactLab methodology, we only attribute social value to participants who engage. So that $55 million of social value is particularly relating to those 48,000 odd engaging participants. And the other thing I kind of wanted just to note here as well was that participant groups are kind of assumed as mutually exclusive. So I've been talking a lot. That's essentially kind of a summary of our outputs and the results from our interaction with the Live Stronger for Longer program. It's been a real pleasure working with their team. And I think one of the things that I've really enjoyed about this engagement is that a lot of that stuff that PK chatted about at the start around the intention and the aim of the program has really been supported by what we've observed in the research, but also in the metrics that we've been able to produce for their team. And so, yeah, that leads to essentially the end of my presentation. And so I guess Brent and PK, back to you, and we can jump into the Q&A.
Thank you, Daniel. That was really, really thorough. Thank you for taking us through that. It's interesting, I reflected as you were going through there. It's part of the consequence or part of the opportunities we had was for you to look at our evidence, our audit, our intervention logic. And it's good to see you've done that in a thorough and positive manner as well. So thank you. Hey, look, keen for you to contribute some of your questions or ask questions of us while we've got you here. If you've got a question following the event and want to contribute to it later, please just send an email, or you could use this chat presumably, but also if you could send an email to preventfalls@acc.co.nz. We will see to it that we answer that, and if it's more applicable for Daniel, we'll pass through to Daniel. Also, I think if you want to see the ImpactLab report, if you could also email us. We will post that report up at some point. At a point, we just need to find out exactly where we were located. But in the interim, if you want to see the copy of the report, please email again at preventfalls@acc.co.nz. So look, we've got a couple of questions come through. So let's just work our way through that. But please contribute any questions as we talk through the next quarter of an hour or so. It'll be good if we could turn cameras on. I'm not sure whether we can turn cameras on, but it'll be nice if you could, just so we get a face to the question, if that's possible. Let's just, the very first question, Daniel, I think is possibly related to you, is how do you calculate total social value? I think you've been through that. It might have come before you actually answered that question, but maybe you just might quickly summarize again.
Yeah, sure. No, good question. I appreciate that for a lot of you, you might have not been exposed to methodology before. Essentially, those 5 GoodMeasure outcomes that we looked at, each of them have kind of within them an intrinsic impact value, estimated kind of on our end in dollar terms. So say, for example, with induced injurious falls, there is an impact value associated with that. We then determine in our methodology, or based on the research and evidence, which participants within the scope were actually, viable participants to receive that impact, that outcome. We then apply it to each of the participants who receive, or I guess benefit from a reduction in injurious falls. That impact value is then essentially multiplied by that number of participants. Within our methodology, we also have various other kind of checks and balances based on natural rate, general population statistics as well. But essentially, that $55 million of social value is associated with the application of those 5 GoodMeasure outcomes to the participants within the measurement period. Hope that makes sense.
Thank you. Did that answer your question, Dione?
And I guess within the kind of the final report as well, there's a bit more detail on our kind of process too.
Cool, thanks, Daniel. Paula Herring had a question. I think that may have been answered, but Paula was interested to know, was the reduction in rehab cost included in the benefit of fall prevention?
Yeah, so within, for example, reduced injurious falls, there's various different outcomes within that impact itself. Rehab was considered as kind of a component of that. I can't remember off the top of my head exactly kind of what proportion, but it was considered within those safe costs of government.
Good. Hamish, nice to have you here, Hamish. Hamish is asking, and a good question it is too. I think I perhaps know the answer, but I might leave it to Daniel to ask. But did we look at the impact of the intervention on the risks of entry into rest homes and the cost of this?
No, that wasn't brought into the current methodology. But a really interesting question. Yeah, really interesting question.
Yep, Hamish is one of the research colleagues and works closely with Interai. So a really good question, and you've done some big thinking on that, Hamish. So keen to see where that goes too. James Whitaker, do you want to even talk to your question, James? You've written more than I can read.
Yeah, I may not have written it perfectly, but you know how we've got those 5 areas you're talking about. Are there known formula that are applied to other similar projects to this? And if so, do you have them somewhere?
You mean in terms of so other programs that have essentially measured the same things? And what's the relativity
or
between
similar programs, or not necessarily strength and balance or aging well, but other social issues that might lead to positive societal impacts, you know. And are there known formulas or averages that you've applied that we could also apply elsewhere?
I think I'm following your question. So essentially, those are the outcomes that we've been able to attribute to the Living Stronger for Longer program. In terms of the formula, it's essentially all internal IP on the ImpactLab end. But there are a lot of general population rates. And I guess, James, if you send me an email at the info at ImpactLab, I can probably provide some clarity on the specifics. There are various organizations that obviously achieve those specific outcomes. From my experience, Living Stronger for Longer has had the largest scale.
Fully. Yeah.
And so, yeah.
I'm thinking, how do you financially quantify someone feeling confident or able to get outside of their house again or do the things they love, or all of those really important things? Are there known averages that have been proven somewhere and applied to various outcome reports like this one that we could also borrow and apply elsewhere? That's the question, you know?
Cool. That makes a lot of sense. I guess within the case of Living Stronger for Longer, a lot of those confidence benefits, for example, would be related to that improved mental health outcome. So within that, it's essentially looking at the intrinsic benefit to the individual. So what's their kind of felt improvement and felt kind of experience, and how does that become more positive over time? So that would account for that. In terms of kind of translatable metrics, it's a bit more hazy. Ours are very tailored to the specific experience of Living Stronger for Longer participants. So they've been tailored to that and based on various opportunity rates that the team have been able to provide us. Flick me an email and I'll kind of potentially be able to dive into a bit more there and provide some further depth.
Cool, thank you.
Good, thanks,
Good
James.
question.
He always likes the curly questions, does our James. Here's a question from Nicola Ward. So nice to have you on, Nicola. I think it's a good question. I think we can probably answer that. So she's asking, how did you match FLS outcomes? Did you look at the fragility fracture registry, not hip fracture registry? So yes, we looked closely at the FLS, the fragility fracture registry, Nicola. We used data from that, and we did some deeper analysis of it. We had, thank you, Paul Mitchell's contribution to that as well, to help us understand how we could draw information off that registry to support what we were doing with ImpactLab. Did that answer your question, Nicola?
Perhaps it's a thumbs up. But
if you're there, Nicola,
can you hear me?
I can hear you now. There you go.
Okay, so did you match it? You didn't claims match though with NHIs. You just made an assumption of a lump group.
Yes.
So, you know, like if there's 10,000 in, you made that assumption of 10,000. You didn't go one-on-one for those outcomes.
No, we used the 10,000. You used a lump sum number. Can that
can that be changed in the presentation to the fragility fracture registry then, not the hip fracture registry? In the presentation, it said the hip fracture registry.
Oh,
it needs to be the fragility fracture registry.
Sure. Okay.
Just because there's strict HDEC ethics. So if it's the wrong registry, then you haven't asked ethics for that. That's all I was thinking about. Thanks.
Thank you, Nicola. Yeah, okay.
Thanks, Pepper.
Thank you. There's another question here. Paula, another question here. Did you draw from Treasury CBAX? Now, excuse my ignorance, I'm not sure what CBAX is.
Yeah, I can take this one. So you can essentially kind of think of GoodMeasure or the ImpactLab process as an alternative to CBAX. So there is some overlap, like CBAX does draw on the IDI and other government databases that we kind of also plug into. Where the difference comes is essentially how we input them into our algorithm. So components of CBAX are kind of included, but it's essentially a different type of social return on investment measurement platform.
Thank you. I might just go to Paul Mitchell because I see you got your hand up, Paul. Perhaps it's related to that last answer of mine. Would you like to? You've got the
this other question asked. Great presentation, Daniel. Lovely to meet you. Superb work. Something I'm trying to figure out is with the fracture liaison services, they deal with the bone health, the osteoporosis side of things, but they're also referring people into community strength and balance and suggesting they use the Nimble app. So it's so a question is, does the methodology enable you to sort of attribute some of the benefit of CS&B and Nimble to the FLSs because they found the person that wouldn't have been found in the first place? Does that make sense?
Yeah, 100%. And we have done that. So it is included within the metrics for the fracture liaison service participants. Good question.
Okay, cool. Thank you.
Elizabeth, you've had your hand up for a while. You've got a question?
Yes, thank you, Daniel, for your presentation. My question is somewhat similar, I think, to Nicola's. It was on slide 15. You were just saying that the starting criteria for FLS is registration with the ANZ hip fracture registry, implying that if they weren't eligible for the hip fracture registry, they weren't included in your figures. And yet you've implied that you've consulted with the fragility fracture registry. So I'm a bit confused.
Brent or Campbell, I might have to pass that one to you in terms of the difference.
Yeah.
I think it's just a typo on the slide, Brent. I think that's all it is. You use the fragility fracture registry.
We didn't use the hip fracture.
That should say fragility fracture registry, not hip fracture registry, as Nicola pointed out.
Yeah, so that was just my first point. And the second point is it's probably my misunderstanding. The period covered was from the 1st of July 22 to the end of December 23. Now that's an 18-month period. So when you gave us the benefits, the total cost of the 3 programs, the cost per person, the total social value, was that for the 18 months? It wasn't per annum.
Yeah, it's for the 8. So it's all relative to that period and scope. So all of the costs, are related to that time, except for Nimble, which had a shorter it was from the April of 23, just given the program started within that year. But would you like some further clarity within the deck there?
Yeah, that would really be helpful, that we can say to other people, this is the benefit on an annual basis. That's all from me. Thank you very much.
Thank you, Elizabeth. Good question. Haminda, welcome.
Hi, Brent and colleagues. Daniel, good to see you as well. Just to clarify, Brent, we did actually use the fragility fracture registry data.
Yes, I thought so, yes. Okay, we will tidy that up. So thanks, Daniel. Thanks, Haminda. Paul, is your hands back up again, or are you from previous?
It wasn't, but I do have a second question if I'm allowed. Something our friends at the Royal Osteoporosis Society in the UK recently did was a really nice analysis about the impact of fragility fractures on older Brits, being classified as people in the range 15 to 65 who are still notionally of working age. And there were very, very big numbers about the number of sick days, the number of potential early retirements. Therefore, workforce participation, big subject. Is that something that does or could feature in your methodology, Daniel?
Yeah, it probably doesn't directly feature as like a specific outcome. It might be attributed for across, for example, the kind of 5 outcomes that we've mentioned, and that it'll consider them as a kind of a holistic outcome. It's not something we would directly measure, but it would be accounted for in some respects. Yeah, it's quite an interesting concept. I guess so. To answer your question, it's probably been accounted for in some of the metrics, but it's not a specific outcome that we've looked at. That said, it's quite an interesting, concept and idea.
Yeah, and certainly potentially as retirement ages change.
Yeah, true.
Absolutely. Thanks, Paul. Thanks, Daniel. Paula Herring, would you like to talk through your question, please?
I feel like you just invited me to the principal's office, Brent.
Feel free.
I think my question is, as we will see the costs or claims track down, because that's what ACC does, and we hope that we will see the claims track down. How do you manage the attribution of the benefit to actually say that this is how much these programs have contributed to the claims saved versus some other societal factors that would confound it? So I'm just interested to know how you manage it, because at the moment this feels really great and exciting, but you will see in this space quite big societal factors change as the next generation ages.
Yeah, that's a great question. And I think cool that you've acknowledged it. Probably something that I didn't quite touch on was in terms of how we measure social value at ImpactLab, we actually conservatively measure it over a 5-year time period from engagement with the service. This is for a few reasons. It's so that we can be pretty conservative in all the metrics that we produce. So for context, at every point throughout our methodology, if we have 2 options or 2 decisions to make, we'll always take the conservative path. So we can be really confident that the estimated social value, is a figure that is usable. The other aspect of that is that it's in line with Treasury. And so Treasury essentially and if those of you who are familiar with CBACs, like all of the measures are essentially put over that 5-year horizon. We kind of include some discounting throughout that process. To answer your question as well, Paula, so essentially all of that value, that $55 million, is that which we believe is attributable to the Living Stronger for Longer program. Within our process is something that we call a natural rate. So our experience has been that some people that you engage with were kind of going to receive those benefits anyway, whether or not they engage directly. And so that natural rate has been accounted for. In terms of those long-term impacts, it's quite interesting in that, so I guess you guys are perceiving that over time, the rates might drop because of the benefit of the service and the education associated with it. And your question is essentially, how would you connect those 2 dots? Is that fair?
Or how to say this belongs to this, but this belongs to that. To actually know what the programs are doing versus just general behavioural trends in a different generation. Because I'm looking at my mother-in-law, who's had several falls. She's got herself a really whizzy walking frame and all those things. She wasn't and has never had the same lifestyle as me. And as I move into my over 60 space, I would say my lifestyle will be quite different from hers, and possibly I would be preventing myself from having the injuries versus a program preventing me from having injuries.
Yeah, that's a really good question. I guess probably my answer would be that within this measurement, we're predominantly looking at those participants in scope. And so it is kind of hard to say. I guess if we were to go through this process again in 5-10 years, there might be some really interesting analytics between the two time periods. But we are purely looking at this one time period. So I guess my answer is it's probably quite complex. Our current measurement is really focusing on those who have gone through that program within that period scope.
So I suppose a really good place to start would be to look at the target population and look at current baseline.
Yeah, totally. And if it's changing over time, I guess that has a pretty good indication of kind of more those cultural shifts rather than maybe an ACC direct involvement.
Yeah, I think Paula, PK here, just jumping in, I think one of the things we are tracking as well is the rate over the longer term, the rate of harm, because the number of people is going to increase in a certain age, and we are keeping an eye on the rate. And at the moment, the rate seems steady, but the volume of people aging is causing the increase in demand.
Thanks.
Yeah, I hope that helps, Paul.
Thank you. Hamish, I see you there. We might just go to your question if we can. I'll come back to those other questions in the Q&A just following yours. So Hamish.
Oh, hi, yes, Hamish Jameson, geriatrician here, and thanks very much for an excellent talk and excellent work. It's great how you've put all these variables together. I'm really interested, we're talking about the falls prevention program and the impact on wellbeing and community benefits. Is there any data on other things such as the age concern visiting service or other interventions we're doing in older people to compare as a ballpark how that stands up?
Yeah, I guess for context, we have worked with age concern before. You'd want to contact them directly for their metrics. Not something that we typically would kind of share on this platform, but if they're willing to kind of share that with you, I'd definitely reach out to them. Yeah, there's also some other work that's been done with kind of Presbyterian support, a few other organizations, but you might have to contact them directly, Hamish.
Okay, thank you.
Just leaning into that, Hamish, I think it's a really interesting question, because one of the reasons why we wanted to do this report was try to bring together that collaboration and alignment and bring all this work together and go, because often in these spaces in public sector investment, you find that there's multiple parties all competing for the same dollar with the same end in mind. And I think there is substantive opportunity for the system to work closer together. And we're acknowledging at ACC, while we're the sole investor largely in this particular program, we can't optimize this program without the support of others. And we really need to improve that our focus going forward.
Okay. Thank you.
Thanks, Hamish. Just go to the questions in the Q&A. Laura and Craig, similar questions really around the demographics or our understanding of the Nimble app, how many are taking part of it, etc. So yes, we're tracking that very closely in terms of registration. So we track the registrations, but we also track active users. And we've determined that users that use it more than 4 times are the ones that are going to be regularly use it more than 4 times are the ones that are going to benefit by the improved balance that they will have through using the app. So we're tracking those very, very carefully. We had a slow start. The registrations are coming forward now considerably. The users are increasing, but it's a challenge for us to get that usage number up, and we're looking further to understand how users are using it and how we can help them become more sticky or stick with the app for longer to truly get the benefit from it. I can provide some further details to you directly if you like, both Craig and Lara, sorry. Does that answer? Was there anything more specific you wanted from your question?
I think there was kind of another question associated with it. So those engagement metrics will be in that kind of final GoodMeasure report, as well as I think I've seen a few questions in the chat as well around ethnicity for each of the different programs, gender, for example, age. So I believe that data is also in the final report. So if you reach out for that through myself or Brent, that information will be there as well. So some more granular demographic data.
Thank you. Paul, your hand's still up. Is that another question? You're welcome.
I am so sorry. I will lower my hand. Brent, I was just putting in the chat to some of the previous comments. For those colleagues that aren't aware, in the ANZ Fragility Fracture Registry, our brilliant webmasters developed this great tool called the Refracture Tracker that in real time will enable us to see if Mrs. Jones came in with a wrist fracture in March and a humerus fracture in September, because it's all NHI linked, and that's a wonderful piece of kit. So early days yet, but it's looking very, very encouraging, and you'll hear more in future ANZ FFR reports on that. I'll put my hand down now, Brent, sorry.
It's all right, no problem at all. Right, was there any other questions? Have I missed something here? Okay, thanks, Lara. We'll look at that. Thanks for including that in the chat. Hey, look, we're getting close to 12 o'clock. We'll wrap up there. Again, thank you, Daniel, for your work and answering those questions. If there's any questions following this, or it comes to mind following this webinar, please can you forward those emails through to the preventionfalls@acc.co.nz, and I think Prevent Falls. Thanks, Kevin. There is a link to that in the chat, so thanks, Kevin, for posting that up. We will make the report available, and we will follow the attendees here up with an email to summarise some of those questions, and also link you to the report and link you to the webinar recording. With that, thank you all. Let you go back to your busy days, and have a good run into Christmas, and nice to have you part of this today. Thank you.